Dr. Doreen Grand-Pichet is the
Dr. Doreen is an expert in autism. Doreen Grand-Pichet.
Dr. Grand-Pichet.
Dr. Doreen Grand-Pichet.
Dr. Doreen Grand-Pichet is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen.
Okay, we have somebody writing to us from India. My child is 6 years old and has issues with Manding and intraverbal questions. Had been in therapy for the past 3 years with a BCB specialist. The BCBA works through a therapist who makes lots of errors and does not correct my child. My BCBA, you're gonna have to send me more of that because I don't have the whole thing, Traven. It's because it's lengthy. But that's a bit of a bummer. If you have a BCBA and you're working remote and the technician is making errors and not correcting, what advice would you have just for that, Dr. Grand-Pichet?
Well, I mean, my initial concern is also that there's problems with Manding and intraverbals. You're jumping like that. That just seems strange to me because Manding and what's the status with tacting, which comes before intraverbals? So that's one question. And also Manding, there's something wrong if you're having an issue with just Manding. Manding is the beginning of everything. It's requests. So my thinking is that you need to revisit the folks who are providing the services. It is part of the BCBA's job for you to train the behavior tech who's working with your child. So maybe you should have a conversation with the BCBA and say, you know, a little concerned, then should we change this behavior tech or this individual therapist? I don't know. You can also have the behavior technician go through the Institute for Behavior Training and get training online so they improve. I have found that there is a difference between people who are certified. So they can become an RBT, which is a registered behavior technician, or they can become a BCAT, board certified autism technician. And that requires 40 hours of class time and some hours of role play practicum field training. And if they do that, they will be a higher quality provider of services. And then your BCBA will have an easier time supervising. But, you know, in the card system, at least, I hold the supervisors responsible for improving the BTs. We provide a lot of training initially, but afterwards, the supervisor's job is to make sure the BT's doing what they're supposed to do.
I've got a little bit more information here too, Dr. Grand-Pichet. She said that the BCBA is not ready to change that therapist at any cost because the child is high functioning and she is verbal, but scripts a lot. And recently her Wisk 5 score and a Wyatt score, they're both really poor. Her ABLES is filled out, but when asked questions from there, she's unable to answer. Please tell me, when you are opening a center in India. So,
okay.
Yeah.
So I have some more comments then. So I think you may need another BCBA. You may need someone who is going to go past the ABLES. Okay, the web ABLES is not going to help your child enough if your child is high functioning. When I don't know what your Wisk and Wyatt said, but a lot of times, even if it's a high functioning child, on the Wisk and the Wyatt, you're not going to do that well, especially on the Wisk, because this is the Wechsler Intelligence Scale for Children, Wisk. And the reason is that, and we've talked about this before, Shannon, is that a lot of these intelligence tests are verbally loaded. So there's a lot of verbal questions and the child is just not understanding the language, the verbal. It's like administering a test to someone in a foreign language and then saying, oh, that has to do with their intelligence. It's not really. It doesn't have to do with their intelligence. It has to do with the fact that they're either not able to attend or understand what's being asked of them. So that isn't going to be a good enough measure. Now, what I think you should do, here's what I would recommend for this family. I would really recommend that you go on Skills and answer, do an assessment. And that's not going to cost you much, I think. So I think you go on Skills for Autism and do the intake, the whole procedure to start up. And the procedure to start up requires you to answer a lot of questions about your child, and then see how that contrasts to the ABLES, because you're saying the web ABLES is kind of almost complete. I guarantee you, when you do the skills assessment, you're going to have hundreds of lessons remaining to teach in the cognitive and the executive functioning, in the language and social areas. So I would really recommend that you complete that assessment, because you'll have a whole new kind of, shopping cart of lessons. And then what you need is a BCBA who is willing to follow skills and do those lessons. And then what you need is really good behavior techs. Now, I do want to say that you don't need to be doing discrete trial. If your child is very high functioning, I don't know the level, when you say, everybody has a different idea of what high functioning is classified as. If your child, but then it doesn't make sense to me that you're doing Manding, because Manding is just teaching the child basic requests. So if your child is not able to make basic requests right now, then we have work to do. It's sort of all over the place. If you really, I think the best thing for you to do is do the assessment on skills. It'll give you a very, very precise kind of idea of all the skills you need to teach your child still, and all the areas that they're very strong on. And then you'll know exactly kind of what to do next.
Okay. I want to say to everybody, skills.
Yeah, it's very confusing for parents, Shannon, when you do one assessment like the ABLES, and you're like, oh, my child can do all of this. And then, you do a standardized test like the Wisk, and you're scoring really poorly. And then on top of that, your BCBA says, no, I love this BT, but the BT is not correct. And it's just like, okay, which direction do I take?
Yeah.
It's very confusing.
But your team has to work as a team and has to listen to each other. And I think the first, people are always asking me, what's the hallmark of a good ABA program? I think, feeling like you're a part of the team is on that list of things. And so if you're telling them the therapist is not doing what you're asking to do, and they're saying it's okay, I wouldn't feel like I was being listened to if I was that parent. So, I would have a discussion about that. I'm not saying necessarily throw the baby out with the bathwater, but have a conversation and say, I need to feel like I'm being heard here. I think that's really important. I also want to tell everybody skills. If you go to skillsforautism.com, you can find skills and find out more about skills. They're offering a discount right now. And there's a phone number. Just call the phone number. Don't worry about codes and things. Call the phone number. Tell them that you heard about Skills on Autism Live, and they will give you a big discount, and that will be a lovely thing. And write to me if that is not what happens, because that's supposed to happen.
That's right. And I want to follow up with what you said, because it's so important, Shannon. A lot of times parents think that they're not supposed to have a say in this. And there's if you feel that someone is kind of putting you in a corner, or making you feel, guilting you into it, or coercing you into it, then that's on them, because you have to be completely part of the program, and you have to have enough ABA knowledge and training to be on board and to agree or disagree, because your child the best. No one is going, the BCBA will know ABA better, but no one's going to know your child as better than you do. So your feedback is vital. And the way that you get into a good cohesive program is that you learn enough ABA that you can speak the BCBA's language and you can understand what they're intending to do. And then your role is to kind of melt it into what's appropriate for your child, and to say, oh, I can see that working, or no, I can't see that. Like, that's not an appropriate reinforcer for him. This is, or that's he's a very visual child. Like, there are certain things about your child, nuances that will really help the program. And then if you understand enough ABA where you can bring that together and bridge it with what the BCBA plans, that's success. If you ever have a situation where on an ongoing basis, the BCBA is telling you stuff that just doesn't feel right, that's not gonna, you're just not gonna succeed. You need to learn more about what their intention is, or they need to be listening to you more.
Yeah, it's hard. It's a tightrope. Let's be honest about that. That, here is this expert and they're going to give you advice about what to do with your child. And sometimes that feels like, well, I know no more about my child than you know about my child. And that's true, but they know more about autism. So you got to work together. And when something doesn't sit right, you have to communicate that back to the BCBA and say, I don't think I can do that. And here's why. So that they understand where you're coming from. And the best BCBAs, the person who was the supervisor on our team for most of the time was so good, because there were times when I would lock up and I would go, I don't want to do that. Right. And she would say to me, okay, I hear you. I hear what you're saying because you're worried about X, Y, and Z. But I want you to know that I've seen this happen before and we're going to be with you on this. And here's how we would work through it if you agreed. And if you don't want to do that, here's what I think might happen, which I don't think you will like. And once she explained it to me, I would go, okay, then let's do that, knowing that my fears were addressed, right? So that she helped me to get all the things out of the way. It didn't mean that I had to just submit. It was a dialogue. It was a dialogue. So if you're saying that your therapist is not doing what the BCBA says and the BCBA says, oh, it's okay, that is not a dialogue to me. Anyway, having said that, but maybe it just needs to have a conversation. We don't know. Christina said, I haven't heard anything about the card reopening, only in the PTA meeting with you. And, you should be getting a phone call soon. And if you don't get a phone call, I would call your operations manager and say, hey, what's happening?
Yeah.
I'm hearing about.
And you might be in round 2 or round 3. So the ones that are opening on June 1st, and then there's another batch opening June 15th, and then another batch opening July 1st. Every 2 weeks, we're attempting to open like 50 more sites if we can. And again, as I said earlier, the sites will change based on the parents' need and commitment, and also based on therapist availability. Like right now, we had to, during the last 2 months, some of our therapists, our BTs, did not feel comfortable coming into the homes. So all of those folks went on either leave of absence or furlough for 2 months. We're bringing those folks back right now. And let me tell you, some of them still don't feel comfortable having contact with the kids. So we might not have enough therapists in some regions. We are hiring again. And we are starting to train again, which is wonderful because so many people need jobs. But it's a time where not everybody wants to have contact with each other.
And I got to be honest, because I know sometimes when we hear, oh, they're not willing to come back and work with the children, it feels like, oh, it's personal. But I want to remind you that sometimes that's for very specific reasons. Like I know at least one person who is a therapist who is living with their grandmother, helping to take care of their aged grandmother. And so they would love to get back with their kiddos, but they're protecting their grandmother. So I don't want anybody to take it personally. It's not about that. It's about each person's individual circumstances, right?
100%.
Yeah.
And I want to say also on that note, there's a lot of our folks who have kids of their own, and their kids are at home and they don't have childcare. So, I mean, that's another reason. And another thing I want to say is so we've had some pretty incredible therapists, and I encourage all of our viewers to go on our social media program with all of our cards, social media. So whether it's Facebook or Instagram or Twitter, even LinkedIn, we have a lot of people we consider to be our heroes. And so we have had a little kind of blurbs or paragraphs and little things about each of those heroes for the last few months. So I really encourage our viewers to go on and look at our hero program, because honestly, I think our people are incredible people.
And it's so, so inspirational to see how much they care and love about your kids. It just takes my breath away. We need to do another show sometime soon, Dr. Grampy Shea, featuring the card heroes, because they're stacking up.
Hey, thanks for watching Autism Live. To subscribe, click here. And if you'd like to check out some more of our videos, click here.